Hi, this is Dr. Donald Pelto. I have a patient with me, and we're going to be talking about a section here on how circulation can cause foot wounds to be slow to heal. If you look at this foot wound here on the side of the toe, you see how it's white and the rest of the toe is red. This redness isn't so much due to infection, because if I push on it, it gets white and then the redness comes back. It's mostly due to a circulation problem, due to these two toes rubbing against each other. That's why I put a piece of lamb's wool right here to separate the toes and a piece of tape on the top and also on the bottom so that they don't rub. Now, this patient has had a previous wound on a different portion of the foot before, and this wound appeared. Now, this patient does not have diabetes, so it's very odd, because many people that are probably watching this have diabetes, but people that don't have diabetes can also get foot ulcers, and this is one of the bigger reasons for it. So this patient is going to tell us a little bit about his story, about the other foot wound that he had, and then this one, and then how we diagnose this in the doctor that he's seeing, and what they're going to be doing for him here shortly. Okay, so thank you for letting me interview you. Now tell me a little bit about, you can just look at me, you don't have to look at the camera. Tell me a little bit about when we initially saw each other, the other wound we were treating, and how the other vascular surgeon helped you.
Yeah, I came in and I was having trouble with my right foot, and basically Dr. Pelto diagnosed that it was probably a circulation problem, and I went to see a cardiologist, Dr. Ruth, and he clarified that that was the problem.
Mm-hmm.
And eventually I had a bypass in my right leg to cure it, and it's fine.
Mm-hmm. And then, so after that one was healed, I think it was probably 6 months or a year, maybe even longer, a couple of years, and then you came in and you had this wound on this toe, and we were kind of trying to figure out what was the problem, and then what did I do and what did I recommend at that time? And
well, you recommended that I follow the same procedure.
Okay.
Actually, you referred me to Dr. Roos,
okay,
the cardiologist, and he checked it out, and it takes stages to get to healing.
Mm-hmm.
Basically, they go and they put a dye in to find out where the blockage is,
mm-hmm,
and then they meet with you, have a consultation. They go over it. They diagram out where the problem is and how it is. And then I believe you said it's an MRI?
Yeah, MRA. Like an MRI, but for the arteries, to look at where the blockages are exactly, with the runoff of the dye.
And, they're going to do that, and then they'll set me up for surgery, mm-hmm, and do a bypass. They take a vein that you don't need, mm-hmm, and they...
Usually your saphenous vein, yep.
Attach it here and attach it below the where the blockage is, and you're off and running.
Exactly. And usually the blockage is right around the back of the knee. That's where most of the blockages are. And he's going to do it so that this wound can be healed. And what I always tell patients, like you, there's not much we can do with this wound right now until we get the blood flow back. If you don't have the blood flow, you're just having to be patient until the blood flow gets back, because it's not infected. The problem with a wound like this is that it's very, very close to the bone. As you can see on the little toe here, there's not much area between the ulcer and the bone. And that's where we have to be so careful that it doesn't get infected, and so that the bone doesn't get infected, because that could be a bigger problem, leading to an amputation, leading to gangrene, where it would turn black. Those are all things that could happen if we didn't get the blood flow fixed with this. So, very good. Well, and so a little bit about your history. Why the circulation problems? Was there a history of smoking? Was there just nothing like that? Just bad genes, I guess.
Could be.
Okay, well, thank you.